This is a video exam or an oral exam of a patient who is having problems on the lower right. But we start with the upper left, and if you notice that there was one spot that when the person's jaw was closing, they were hitting the red dot. And we'll come back to that in a minute. You can see how on the upper right, the patient had her bite adjusted numerous times. And now we have them closing on black paper and seeing how their jaw comes together. And right at that moment there, you saw it shift a little bit to the right, and you'll see the difference between the red dot, which is where she first closes when she comes down. It's what's considered centric relation, or CR. And when she bites really hard, you'll notice the black dots. Also, that particular crown, tooth number 15, upper second molar, you can see that the crown, the porcelain, has been chipped, and that is a compromised situation. The patient gets food caught there all the time. The tooth itself, the porcelain also is very thin. Now, we put the articulating paper in, and if you notice, the patient isn't touching anything at all on the upper left. Just the second molar, and that's where right there you can see she's coming down on it. And we go back to look at the red spot and the black ones, but there's no black spots anywhere, and that's because the patient isn't touching. So we'll go ahead and take a look at the patient's right side, and this is where she's having the discomfort, lower right, and you can also see how the gum tissue is very irritated around all her crowns. Tooth number 2 is the one that has been adjusted numerous times. There's a little composite filling up there as well. And we go ahead and have the patient close in centric relation. And basically, the thickness of the paper, she's able to create a little bit of a mark, particularly on tooth number 4. This one, tooth number 2, we get a little bit closer look. And when we go back to check, you'll notice that it's really more the paper mark. Then again, we'll go ahead and look at all of the crowns that she has in her mouth in a minute. This is the black paper, biting down as hard as she can. And you can see all the black dots that are hitting. It's on the second molar and also on the upper first molar. You can see the space between the tooth number 3 and 4, and she's getting food impacted there. You see where the red dot was on tooth number 4 as well with the black one. There's no food impaction between the 2 second molars, and yet the gum tissue is highly irritated. And the gum tissue also is red like all the other ones. Even though we'll clean that up and get some of the material out and clean that up nicely, it's still going to be red and irritated, because it looks like the patient is allergic to whatever metals were used for the porcelain to metal crowns. Every crown she has is like that. We go over to the other side, and you can see the irritation on all those crowns. Doesn't mean that she necessarily needs to have those out, but that's a situation for any crowns in the future. Certainly, we don't want to have that type of irritation around the tissue. The patient doesn't seem to have any bone loss, and those crowns have been there for some time. Go ahead and look at the bottom teeth, and you can still see the inflammation around there and how the gum tissue is really irritated. And at some point in time, those crowns, the one on the lower left, I believe, is a new one. they're functional, but at some point in time, they probably should be replaced. I really don't know what the bite will look like until after we mount and see what it will take to get all the teeth coming together. My hope is that we would be as conservative as possible in trying to figure out if we can just smooth a little bit of the porcelain off on many of the teeth, and the teeth that really need to be replaced anyways because they're chipped and have open contacts. Those will be replaced. Looking just at the lower front teeth, it's been a few months since she's had her teeth cleaned. The tartar's there. Some people do need them cleaned every 3 months, and that's the case for this particular patient. She's been doing it in the past. You can see a little bit of the tartar there. There's the irritation around that crown as well, and in any crown that she's had some sort of reaction to the metal that was used. Go back and look at the front teeth. Tooth number 7, the upper right lateral, is also a little irritated, but if you notice that tooth is a little bit darker than all the rest. And it's just something for us to keep in mind. It's probably still vital. You can see the teeth where they're not quite coming together. We will use, and there's also some recession. The patient's aware that she brushes a little bit harder than normal. And she's got a little divot in the root of the teeth. That could also possibly be involved with occlusion, though the patient wears a night guard every night without fail. Has been doing that a number of years. Now we're going to go ahead and have the patient close on some shim stock or artist paper, and you'll see that on the right side, the only tooth that's touching is the second molar. And she bites down. That's the little spot that just barely touches, and I'm still able to get it out. And the tooth in front of it, she doesn't touch at all. The tooth behind it, there's no occlusion, and it's truly on the upper right second molar, which she's having her discomfort on the lower right. Those were 2 new crowns that she had placed on the lower right, and is trying to find some way to be more comfortable. Here again, we just go through again, it's showing on the left side, there's nothing touching. So basically, her 2 back upper molars touch, and the rest of her mouth isn't involved. There she is, touching just a little bit of the mesial of tooth number 15. And that's the full closing shot there. Well, the first thing that we're going to do is mount the case in what's considered centric relation, and from there determine if we can just smooth some of the porcelain down and allow the patient to hit all her back posterior teeth. We'll also look at if it's possible to do the anterior teeth, but my guess is that that's going to be difficult. But I won't know until I actually do an analysis on it. Then we'll bring all the information to the patient and allow them to understand and decide what would happen if we do no treatment, and giving her other options as well.